This summer, don't send a fan to do an air conditioner's job. Call your local Daikin Comfort Pro before it's too late. Daikin. Comfort for life.
The way the world is today,
Go! Go, go, go!
things just seem so out of control. That's why the things we can control are so important. That's why we're members of our electric co-op. The whole reason the co-op exists is to bring us the electricity we need. So they look out for us. They invest in the best technology you can get, just to keep the power on. Not because they have to. They actually do it because it's the right thing to do.
All right, welcome everyone out to Fairview Park Hospital. We're here with Dr. Jasper. You may remember him from earlier shows we've done. Dr. Jasper, thanks for joining us again today and for talking with us a little bit about issue of Alzheimer's or dementia. We wanted to come out and talk to you a little bit so that people would know how to deal with issues of a loved one, someone that they may be caring for, someone in the family, a neighbor, what have you, who may have a dementia, may have Alzheimer's. A lot of times we don't know how to respond and, to them not knowing what's going on. So we thought we'd come out and talk to you and maybe look at some scenarios, some things that are common among those with dementia who actually have to come in through the emergency room.
Right. Well, having a loved one with dementia of any type, whether it's Alzheimer's or some of the other ones, can be really devastating to a family. And it really is a difficult topic to to deal with and handle, primarily because early on in the disease process, there may be minimum to no symptoms. And I think it's recognizing that the loved one, that something is different, whether they're being more forgetful, forgetting where they put their keys, or you notice that they're asking questions or saying things repeatedly that they just said. So I think the first thing is to remember that patience is going to be one of the greatest things you can do for a loved one who is, suffering or dealing with dementia. And then with that patience comes the understanding that it's often going to be progressive, and you have to really even more, understand and step up that part of your relationship. So we often say that for many people, it's going to be early on you being their memory. So you being able to have that conversation and remind, mom or dad or sister or brother or any relative, oh yes, we did go to the park yesterday, or, and understand that along with the dementia comes some really feelings of lack of confidence in the person as well. So sometimes the questions are just to know that you're there. So sometimes a loved one will ask something repeatedly, but it's not always because they entirely don't remember, but they need that sort of comfort and confidence that there's a loved one there that's going to help them. So remember, first, recognizing is important, remembering to be really patient and understanding that it will be a progressive disease. Now, as far as the emergency department, one of the really important things is the issue with dementia, elderly, and falls. And, I was asked to sort of talk a little bit about that because it's such a big thing. In our population, the number one reason that a lot of people over the age of 65 will seek medical attention will be because of falls. And greater than, age 65, those falls come with a high risk. And that risk is really for hip fractures. And we like to talk about that because when a loved one has dementia, you have to recognize that you have to change the environment. You have to, in a sense, as we remember when we were children, we would say we would child-proof an environment. So for patients suffering from dementia, you have to remember that you have to actually proof the area so that they're not going to suffer from those falls. Falls, they're a big reason for anyone, over the age of 65 having a long-term health problem, but they become even greater when you have dementia. So just to kind of talk a little bit about that, why is it important to try to prevent that? It's because, there's about a 30% mortality rate within 1 year if an elderly person suffers a hip fracture. So imagine you see your loved one and they fall, they break that hip, and you're thinking 3 out of 10 won't be here a year from now. That's pretty devastating to any family.
Yes.
So the number one way to deal with that is prevention. So remembering that with dementia, not only do you have a cognitive part, meaning things that happen with your memory, which is what most people actually associate dementia with. And I think this part that I'm going to discuss now is one of the most difficult things for people to understand, that what comes along with dementia isn't all just memory. So I like to always give people the example. So Alzheimer's, clearly the first signs will be usually memory and cognitive, like thought processes. So not remembering, exactly how to do a math problem if you're helping your kids or grandkids, things like that. And oftentimes families can deal with that. They can sort of circumvent that. But it becomes difficult when grandma can't remember how to eat or can't seem to remember how to speak. And those are things that we sort of take for granted and we assume is not a memory issue. But I remind people, when you're babies, and it's interesting, we go back to sort of the babies, a baby can move every part of their body, but they can't feed themselves, because it takes some experience and then memory on how to hold the spoon or the fork and to do those things. So it's something as we get older that we call muscle memory. So when your memory goes, your muscle memory eventually goes. And so therefore, the things that we assume are regular daily tasks become very difficult. And when you have Alzheimer's, it becomes particularly progressive over time. And part of that is remembering that we had to all learn how to walk, and so now we walk without thinking about it. So we learn to drive, and then we seem to drive, and we can't remember the last 10 miles because we were just driving, and it's like muscle memory. So as you lose that sort of memory, you lose the ability to do some of those things. And when you lose that ability, walking all of a sudden can become more difficult. And then if you remember, you lose the memory, you will often forget what's in the room. Was there a table there that you forgot about? Or, I always tease my younger folks when they have like ankle injuries. And I said, you always remember, you like twist your ankle and you go to bed and you forget, you step out and you, whoa, I kind of forgot that I had that injury. Well, imagine that happening to you every day. Not remembering that you really can't walk that fast or you can't do some of those things. So you can see, if you tie all of those in together, that now falls become a higher risk when you have memory impairment. And we want to try to proof the area and to assist the loved one so they're not going to be the person that gets up, gets out of bed, forgets, and falls or hits something and suffers from hip fractures. And then another part of that is, remember, we've come a long ways in medicine. We don't have a cure, but we have medication to try to slow some of the process and to help as they get more advanced. But those medicines come at a cost, and that cost is the side effects. And so a number of the medications used to treat Alzheimer's dementia are known to cause hypotension or a lower blood pressure. So oftentimes you want to make sure your loved one is going to sit on the edge of the bed before jumping up, or they often will pass out.
Okay. What are some of the types of drugs that are being used now?
Well, it's really a class of drugs. They're like cholinesterase inhibitors. There are three main medications that are sort of branded.
And all have a side effect.
And they all have side effects. There are two drugs in particular that actually are used to treat early, mild to moderate sort of Alzheimer's. And there's one drug that actually is indicated for all stages. And I don't have any stock in any of the companies, but I try to keep those medications. But just know that there are medications out there to help with your loved one, and in particular one that's indicated for all phases of Alzheimer's, and then 2 that are primarily for mild to moderate sort of dementia.
So it seems that a repetition, a daily repetition with that person suffering from the dementia, from Alzheimer's, or reorientation of things might help?
I think one of the best things you can do is to remember that, again, to have that repetition, but also familiarity. So a lot of times this is the time to give them an environment that they're familiar with, because a lot of times our really deep-seated memories are the last to go. So the first things are usually the new memories that are hard for them to sort of keep. So meeting someone and then coming back minutes later and not remembering you met them. But in the beginning, you remember your children, your spouse, relatives, big, great dates in your life, birthdays, reunions, anniversaries.
Yeah.
So you want to keep the environment sort of familiar for them. And that's where really it's challenging, in our society now, because as they get into a deeper, stage of dementia, it becomes more difficult to manage. And we oftentimes seek attention and help, like whether it's assisted living or nursing home placement. And that's where it becomes really challenging. What some people have done is they know they need that help, so they will have the loved one at a nursing facility, but they try to make the room for similar to the room at home, or bring in pictures, bring in furniture from the bedroom and things like that to give them a lot more comfort and stuff.
A lot more familiarity. Hopefully, it'll trigger something positive.
Correct.
This is obviously a terrible disease that so many people or people's families, someone around. You don't have to look far to find someone with Alzheimer's and dementia these days. And I guess we continue to try to find the cure, try to diagnose things. And so that's why we wanted to come out and be able to speak to you, Doctor. Now, when something happens with someone like this, of course, if they do take a little spill, if they do bump into things, and they're already a little disoriented, many times they need to be checked out, don't
Correct.
they?
So remember, they may not remember the circumstances of a fall or any kind of injury, and they may not even remember they have that the hip even hurts. So really, it's going to be important then to have a family member or loved one that can really accompany them and kind of provide a good history. And as physicians, what we do is we treat it as all things are possible. So, if you bring them in, you come into the emergency department, we're going to do that sort of traditional check them out. And usually for people with dementia, it's really checking them out. So you shouldn't be alarmed if you're going to notice they're getting x-rays or CAT scans and things like that. But we know that, there are going to be times when they just can't remember what happened, and it changes what the outcome may be.
Yeah, so you're always here at Fairview Park Hospital, Dr. Jasper. We appreciate you speaking with us today, and just reminding people that if they deal with someone with a dementia, with Alzheimer's, that you're always here 24 hours a day to help, and better safe than sorry.
We're always here, better safe than sorry, and remember, it's compassionate care, especially for those family members dealing with dementia.
Thanks again. Thank you for joining us.
Hello, I'm Joyce Taylor, bookkeeper for Premier Properties.
Hello, I'm Dan Coxwell, property manager for Premier Properties.
Hey, I'm George Best, Realtor for Premier Properties of Dublin.
Hi, I'm Edyie Webb, Realtor with Premier Properties of Dublin.
Hi, I'm Michaela, Rowland, Realtor with Premier Properties of Dublin.
Hi, I'm Marcie, Weinhold, Realtor with Premier Properties of Dublin.
Hi, I'm Phil Best, qualifying broker for Premier Properties of Dublin. We're proud sponsors of Alzheimer's Awareness Month. Here at Premier, service is our culture.
Portions of this program are brought to you by Johnson Brothers Funeral Home, serving our community since 1937.